The Map of Medicine is an online collection of evidence-based, practice-informed care pathways which connect knowledge and services around a clinical condition. The map has been successfully localised to create nearly 1,400 pathways which reflect local clinicians' and commissioners' needs, delivering real efficiency savings and improved outcomes. The Map of Medicine helps clinicians and commissioners address challenges in their local community by affording commissioners the opportunity to design a care plan that engages multiple care settings and providers. This helps the providers meet QIP, QOF and sequin challenges in their community by reducing unnecessary variation of care, improving quality and providing measurable improved outcomes.
We became aware of Map of Medicine about 4 years ago when we tried to think of ways of helping GPs make decisions about using hospital services. And after a meeting with the medical director at University Hospital Southampton and my counterpart in our neighbouring CCG, we agreed that the map should be the vehicle for describing guidelines that we'd want to develop for local GPs. And we've gone through a process in the last 3-4 years of localising maps in addition to the 400 national maps there are. What we do when we localise is to take a national map, use that as our basis and adapt to local guidance but also to describe local services. But the real benefit of it is that it provides ownership of the map. GPs and consultants feel that this is their map that describes their local service, and that means they're more likely to use it.
In Merseyside, we market the Map of Medicine as a yellow pages for clinicians. All localised pathways contain real Liverpool-centric information, such as patient information leaflets and localised clinic details. The Map of Medicine is accessed via a desktop icon which has been deployed to all GP practice PCs, and benefits are monitored and tracked through usage and referral rates.
We've designed many care pathways across Liverpool CCG, and the Map of Medicine has been helpful at ensuring that the latest care pathways are always available for all the GPs across the region. We've noticed through working with Map of Medicine that we can improve the quality of referrals by providing information to GPs, and patients are now seen more quickly and receive better care. We've noticed through using Map of Medicine and other ways of working in terms of quality of referrals that we've reduced the number of inappropriate referrals for patients, and this has led to a saving of £500,000 last year in Liverpool.
There are several benefits that we've gained from using Map of Medicine. Perhaps the most important for us is the improvement in relationships between GPs and consultants. So localising a map means that we have to sit down as GPs with consultants and talk about best practice and the most efficient way to use hospital services. And this has given us a much more dynamic edge to the discussion between us. We also use the map to describe a commissioned or contracted pathway, and it becomes our default resource. So we have clinicians and managers referring to the map on a regular basis to say, well, how do we manage or how do we approach this particular clinical problem?
Because of a Map of Medicine care pathway, we've been able to significantly reduce the number of referrals into gastroenterology. We now provide patients with a H. pylori breath test in primary care prior to referring on to secondary care services. This not only allows our patients to receive this test within their GP surgery, which is much less invasive than that in secondary care, but it also gives us significant reductions in associated costs across the gastro pathway.
I'll use the map during a consultation to provide myself with guidance, but also actually to share the information with the patient. I'll explain to them that this is what we've agreed locally is how we manage a particular problem, but also it provides me with pictures and also web links to patient resources. We're clear in our own minds where we're going with the map, and the system we have established for developing new maps is ongoing, and we have 4 maps being developed on average every month. In addition to that, we're starting to look at using the map to describe management of emergency and acute problems.
The Map of Medicine is a proven tool for helping commissioners and clinicians work together to design local care pathways. This works across care settings, triggered by the GP, who will have the map as a one-click access from their desktop, integrated with a medical record system. This helps improve outcomes and ensures consistency of care. Map referrals ensures that the GP can refer appropriately with consistent referral templates into the secondary care settings. All of this drives consistency, quality and improved outcomes for patients.